starting.
Okay. So, just to recap, pregnant woman. Mary is our pregnant woman. She is not actually pregnant. However, we will be using her as a demo. So this is important because sometimes you will get pregnant clients. Most of my pregnant women are troopers and they totally avoid common medical knowledge, like at all costs. So they'll just kind of hop on the table. They might ask to be bolstered a little, but they don't prefer side lying normally unless they have like really bad back problems from their pregnancy. And then when they come in and they're like, my back's hurting, I can't do this anymore, they look at the table, they kind of side-eye it a little bit. That's when you know that maybe switching it up in terms of just positioning would be the way to go. And then medical knowledge tells us that they need to be on their left side as opposed to their right side to make sure that the blood is flowing properly. So what we are going to do is we are going to use a big bolster. If you don't have a bolster, what would be some other ways that you could create this type of lift? Pillows. What? Sheets. Like, get creative. This is blankets. You could use blankets. You could use harder things and then wrap them in softer things. You could do so many options you have. But if you wanted to invest in like a big old yoga bolster, I know a couple shops around town have them. Stephanie probably has them over at the Sunset Park Massage Supply. So all of these would be good options just to have on hand because you never know when you might need a bolster. Also, when we get into the respiratory system and we'll do a bolstered up session that way, we'll also use that in there. So let's have you get on the table. Okay, so she's going to be on her left side. And then basically what's going to happen is this. She's going to take her right leg and she's going to drape it over the bolster. So the bolster is going to be kind of catching that leg. If she really wanted to, she could bend that back knee if it felt best. But notice how she also has space underneath. Yeah? Mm-hmm. So if you wanted to be like super duper throw, you could take an extra fleece and just kind of knock it right there, just to make sure that she feels totally supported. Do you feel totally supported?
Yeah, that's better.
Excellent. I paid her to say that. So when we start to work now, there are a couple different problems. How do we do relaxation techniques? Yes? How do we walk reflexes that might be underneath? Yeah? So the session dynamic itself changes drastically. So we'll do a quick half-hour demo on just how to walk the reflexes. And basically, since I don't even do this very often, but you all should at least have this in your back pocket for those moments when you might need it. It's about taking the basic thumb and finger walking and applying it to just a very different shape. The routine still holds. You're still covering the entire area. We just need to get a little bit creative, learn how to work under, over, sideways, and also not compromise your own body mechanics. Yeah? Okay. So, let me go off camera real quick and grab some of the shea butter.
Close up on the floor.
Which we keep away from Jeanette.
Please, thank you.
Please and thank you. I need to get that thing out my face. Okay.
Under the chin shot.
So, grab a couple dry towels. At the end of a half-hour session, we normally do our towels, so we'll do those at the end. What is the first part of our routine? Solar plexus adrenal, right? Yeah? Pretty easy.
Horizontal.
Yep. So it's literally just about shifting. Another great reason to have a rolly chair in your office, and one that goes up and down, because I'm high right now. If I was doing, I'm totally high. Right?
I was biting my tongue.
Thanks, Andy. I appreciate it. Pause for comedic effect. But as far as like my leverage goes, and we've talked about this before, like when I do a reflexology session, I'm normally down here. Yeah. Because depending on table height as well, if your table is lower, you don't want to be curled over. But for here, you actually need that lift in order to get to where you can be on level and not feel like you're, you know, cranking your shoulder out. So then we go halfway down, in between first and second toes, right on the medial side of that plantar tendon for adrenal. So super easy, yeah? You're just learning to work from a different position. And again, not all pregnant women will want to be side lying, and some clients who are not pregnant may want to be side lying.
I was wondering about that.
Yeah.
Because I've had people that have laying on their back for an hour is really hard. We've worked on with one lady I have, she's actually putting like a towel under her lower back, and it's helped, but she still gets discomfort after a while.
Yeah.
So I'm wondering, would that be better for her?
Yeah. One of my favorite low back clients, she actually we'll do hot towels beforehand just because I want to share this story. One of my clients, she literally is not supposed to be walking. The X-ray shows that her spinal cord technically has been severed, but for some reason she can. Like, she's a medical anomaly, and they don't understand it. And if you knew her, you'd understand, like, it's just sheer force of will. And she's amazing. She's so lively, but she cannot lie flat on the table for more than, 10 minutes at a time. So, basically, what we do with her is we keep her side lying, but even then, she can't be in one position for more than, that 10-minute time frame. So we really want to make sure that the client is comfortable at whatever costs. So we'll rotate her, we'll flip her like a flapjack about halfway through the session. Okay, so you see, instead of doing the fleece over, instead of doing the wrap over with the fleece, we're using a dry towel. Whoop. Mary's trying to help me, and I'm trying to help her, and so instead we're using the hand method of using the dry towel to lock in the heat as opposed to the actual fleece. And you can also see how I stood for that, yeah? Client doesn't know. The sigh of contentment.
Is that the baby kicking?
That is. The baby is definitely kicking. Mary the medical anomaly. Which fits. Okay. And if you don't get it right, don't worry about it. Use what's left of the dry towel to just dab it dry. If you wanted to wrap the foot, you totally could. Just having another extra blanket, extra piece of fleece, something like that. Oftentimes, here's a fun trick. I'll show you afterwards. Because we're going to be starting on one foot. Doesn't matter what foot though. Okay? So if you feel more comfortable starting with the right, you could start with the right. If you feel more comfortable starting with the left, start with the left. Whatever you feel is less intimidating for you. Because if you're doing this for the first time, like, the one thing that you don't want to do is freak out. Because it's new, right? So just do what feels comfortable, remember your routine, and just get it done. Because now is not the time to be perfect. Now is the time to just make the client feel comfy. Okay? So if I wanted to be, like, super fun about it, here's the Sambelier patented blanket throwing technique. You could even wrap the foot with the blanket. I know. Ooh. Ah. Okay. Now, as far as relaxation technique goes, sloppy Susans are out. Like, we can't That's weird. But we can do a little bit of ankle work. It just doesn't make sense from this angle. So again, we're going to rolly chair it out, slide underneath, and just do a little bit of ankle rotation if you feel like you can. You know the techniques though. If it doesn't feel like it's working, move on to the next one. You could do calf massage. That's nice. The one that I really do enjoy the most from this position is the push-pull, because you can still really get underneath and you can still really apply that pressure, and you feel really, really on point with this in the side lying position. All the other ones tend to be a little bit weird. Okay. Heel rotation, if you really wanted to, you could. You would just need to brace differently. Do you see how I did that? And then your momentum is going this way. And then I'll switch hands and do the knuckle roll. Okay. Walking the spinal reflexes. How would we do that? You could double thumb walk. Oh. Ooh.
I do that anyway.
Of course you do.
Yeah.
I do that anyway, which is why you will never teach.
Oh.
Because if you can't get the basics
Do you hear
right,
Do you hear the disappointment?
That's so sad.
so sad. If only he did what Sam asked the first time, instead of making up his own routine. Cody's Advanced Reflexology Techniques coming to school near you in June. Okay.
Interesting weekend.
So, 3 times up the spine, then we go to the toes. The toes are pretty easy, pretty much the same. Start at the 5th digit. You just need to kind of get the wrist in there a little bit. Nothing fancy. Just like with all the other techniques, we want to make sure that we're keeping contact. So even though it might be awkward, especially with the easier techniques like the toes that are nicer to you as therapist, you just want to make sure that your hand is always resting somewhere. Okay. So other reasons why you might want to do side lying, not just back pain, hip bursitis, especially if it's on, you know, the side, you would turn them on the opposite side. Obviously, you wouldn't want to roll them onto the side with the hip bursitis. That would not be a nice thing to do. But also chronic lower digestive issues, if they're having an IBS flare, yeah, menstrual cramps, anything with that kind of deep pelvic issue, stabilization, pain, discomfort, or if the client just asks.
What does she have under her neck right now? I don't
Just
know
a pillow.
Okay. I don't know. I didn't see that part, so I was curious.
Yeah.
What she had.
That is a good point, though, because in terms of, like, if the client had neck or shoulder issues,
Right.
it might be a little bit uncomfortable.
Right, that's what I was thinking.
Yeah.
Yeah.
So, but if they're a side sleeper, if they're good with it, then totally. You just need to make sure, and that could be corrected really easily with just a little bit of lift. Yeah. So now we're on to that big toe routine. Pretty much the exact same. See that really good color change. It's all working out exactly the way that it should.
So lymphatic pump would not be very doable.
Mm-mm.
Is there anything new that you would add that's advantageous?
No. The reason for the routine is not because Sam said so. It's because you need to make sure that you're hitting every single reflex area. So the routine covers that. If you just stick within, you know, first we do spine, then we do toes, then we do dorsal aspect, then we would do chest lung, then we do upper lower digestive, back to the toes, then sciatic area. Even if you need to omit a technique, you need to touch every area, not just for manual, but also for assessment, right? So we'll do ball of the foot, just that shortened half-hour technique version. And it's feeling just a little bit weird, so I'm just going to switch hands. Because you can do that. Okay. Now for a half-hour reflexology session, we do digestive next. If you're short on time, you could cut out the horizontal walks and just go vertical. Again, with that idea that the routine, if you don't stick to it, the body isn't going to explode. But the thumb walking is the technique. So making sure that you're thumb walking over every area to stimulate the nerves and to palpate. You know, you want to stay away from spending too much time on the relaxation techniques. You want to stay away from, you know, just rubbing through an area. You want to make sure that you are systematically hitting all of these places multiple times, but that doesn't mean that, you know.
Why would you choose vertical over horizontal?
Because horizontal goes 5 to 3.
So
Yeah.
covering more.
Yeah. And then there's this really fun kind of conundrum when, which is, we'll talk about this more when we just ever so gently review A&P. Most clients don't even know that they're pregnant when they come in to see you. So I've had, you know, clients coming in for multiple sessions, and they're like, oh yeah, by the way, do you remember how you kept telling me that something was off with my hormones? Yeah, you know, it just so happens that I've been pregnant this whole time and I didn't know it. And I'm like, okay. So, did you need to bolster them? No. You know, did you need to do anything different? No. So this is normally just for clients who really feel like they're physically compromised and they just need to be in a different shape during their session. So that would be the conclusion of the half-hour technique, really nice and easy. Let's go over some individual reflexes, just to give you an idea of how I would work them during a session. Let's go over ankle stuff. Okay, so how would you access the ankle? Double thumb pump from underneath. Yeah, zoom in on that magic. No, just kidding. What? Yeah, hip reflex. So that same crescent that we would normally rotate, both thumbs are hooking into that space and doing a pump. Okay. Cuboid notch is pretty much the same. 2 fingers, really easy to trace up, down, back, and underneath. Dorsal ankle. The pump is difficult, but you can still pump without pumping.
Paradox.
Yeah. So you can still get the fingers in there. It's just not, the ankle isn't going to move as well.
So you're pulling instead of pushing?
You're still pushing. It's just obviously the foot isn't going anywhere, but the fingers are still getting into the groin reflex.
Okay.
Erica Hodgson says, "Happy Saturday."
Hey, Erica.
Also, should I notify you if you get any Pokemon notifications?
Hilarious. No. Okay. So then let's talk about dorsal surface. So we can do dorsal surface pretty much the exact same way. The one thing that you want to just be aware of is that you're going to have less leverage, but all you do is curl. That's it. So starting at the top and curling into the dorsal aspect. And if you feel as you go that your hand is compromised, you can always slip one underneath and do it that way. So super easy.
So you're doing the valley.
Yeah, the dorsal valleys. And then heel aspect, okay? As opposed to the underneath curl, you could do double thumb walk again. Flip it around. As opposed to trying to go.
I was.
know,
How's
that-
he gonna do the other side?
Exactly.
Man.
If you worked for Circus Olay at one point, that might be a little bit easier, but okay. But at the same time, the heel, super easy, just like you normally would. Stabilizing, making sure everything's okay.
Andrea Nunnery says, "Hi Sam, any plans to come to the UK and share your knowledge?"
When somebody pays for my ticket. How
Alright.
about that? No, but I've gotten so many requests from all over the US. If you could Skype me in, that would be better. I could do a remote class and not have to get the jet lag. So we will see how that develops. Okay. But you can even see, like, just from an assessment standpoint, did you see how I was walking and that tissue just totally, it evaded right there? Like, you can tell that there's something in that area. So with reflexology, you know, and to your point about the room being a little bit dark, it can be hard to pick up on stuff like that. But there's also texture underneath as well that gives me that. So it's kind of that toss between feeling and looking at the same time.
It seems like for the hips, you might get a better advantage.
Mhm.
This, I mean, if somebody's really having some hip, you know, you really want to work on that lower body.
Yeah.
Would that, just for technique reasons, sideline them so you can really like, because
Totally. That's a really good point. So if you suspect somebody has a hip that's out of place, a hip that needs to pop, they say that, you know, they've been to the chiropractor can't move the bones, you know, they've been having, maybe they just had spinal surgery. You know, anything lower body wise that you feel, knee replacement, anything that seems lower body compromised, feel free to whip out this position. You know, if you feel like shifting pressure in this way, it's just the male. If you feel like shifting pressure in this way would be therapeutically beneficial, this is technically a pose that would be used in a restorative yoga class. Yeah? Just being on the side can be very beneficial. So just something to think about. And then as far as finishing up with the relaxation techniques, normally I'll just do another round of push pulls, maybe some heel rotation and knuckle roll, and that's it. You could go down. God forbid. Whatever. What?
Sorry, Carla Walker says hello and she wishes she was on the table. And then Tanya says that she loves your webinars and thanks so much for sharing.
Perfect. Awesome. Okay, so how do we flip this bad girl? Well, first we have to remember that we wrap the foot, because that would be awkward. Yeah. But at the same time, if you wanted to switch her to the other side, second session, you could totally do that. If you have them covered, I would recommend gently removing the cover and having them flip. Yeah. But for pregnancy, if they're okay with being on their left side the whole time, sometimes being on the side too long can start to jack up the hips as well. We'll just, in theory, say that everything's fine. Everything's fine with Mary. She's enjoying the session. She's snoring on the table. Everything's great. So all we're going to do is unwrap the foot that we're going to work on. And then if you wanted to, you could totally wrap the other foot, kind of tuck in the blanket a little bit just to make it nice. Okay. Okay. So now this is happening. Okay. So you move. Okay. And my chair won't go any higher. So if you wanted to like prop yourself up with another blanket, you totally could. I'm a boss. I can do this. Let's see. Where do we want to go from here? Let's do a couple rounds. Actually, if you wanted to do a standing, you could do that. Get a little bit of ankle rotation in there. Instead of push-pull, you could push-pull. Yeah. As opposed to the fist, you're pulling back and pushing forward, getting a little bit of torsion and rotation happening in the foot, which is delicious. Yes. Obviously you can't do heel rotation from this angle, but you could if you just switched a little bit. Spinal reflexes are face down, so we can't do that. But you can just work with what you got, okay? Now, as far as working the spinal reflexes first, this is where you could curl, finger walk the spinal reflexes as opposed to thumb walk. Okay. So just like we would over the dorsal valleys, you just take the fingers, starting at the lower back reflexes, and curl. Go ahead.
This seems good for palpation because you can't see directly, so you're feeling more, right?
Mm-hmm. Yeah. So actually, we just found a spot, really nice spot in the lower back on the right side. So I'm just gonna hold that little baby. But yeah, same thing. You would just go through the exact routine, and this is why memorization helps, so that you at least know what comes next, where things are. I remember at the very beginning, though, I kept my room really dark, and it was literally me squinting, trying to figure out, like, I'm on the blue blob, but what does the blue blob say? And there were moments where I just abandoned all hope during the session, and I'm like, I'll look at it later, until you realize it. Okay. Then we're on to the toes. Thumb is on the top side instead of the bottom side. Works the same way. And especially if you are a therapist that doesn't like to sit, you could stand while you do this. Yeah.
Are you higher than before now?
Technically.
Oh.
Technically. But with this game, I remember the first time that I tried doing this position, I really jacked up my shoulders trying to like maneuver and wiggle, because I had to do it on the fly. Like, I invented the techniques because nobody nobody told me that this was possible. So in my freak out moments, like the client totally enjoyed the session, but at the same time it was new, and so my body didn't like that. So even if you wanted to, just on friends, on family, give this format a try and at least have the muscle memory of it, so that you can know kind of when to do what. Okay, so here I'm finger walking the neck reflexes as opposed to thumb walking. Your thumbs aren't the only appendage that can do reflexology from the hand space. I'd avoid pinky walking though. It's not as strong.
Elise Epps wants you to come to Brazil.
Thanks, Elise. Love Brazil. American Airlines, right?
So when are you gonna own your own jet and then we can fly with you?
Totally.
Yeah.
Entourage.
That's
Oh my God, that's
All
funny.
right, talking.
That would be awesome.
Take his crew.
Yeah, exactly.
See, that's the thing. Like, if I were to go somewhere, I would totally want to, instead of like actually being there though, I'd totally want to Wizard of Oz it and like Skype myself in and be like, yeah, as opposed to being there.
Why?
Well, I don't know, because it's like when you're working, you're working.
Yeah, but you
Yeah.
get to. It's not work all the time.
True. Well, because I just, like, Elite contacted me, Elite Continuing Education, and they're like, would you travel to other states if we filled a class for you? I'm like, how big is the class? They're like 60 people. I'm like, yeah, I'll travel. You know, from that standpoint. And it was like, you know, you guys would take care of everything. You would take care of flight. You would take care of hotel. You would take care of in and out. Like, I wouldn't have to, you know, mess with any of that. And like, yeah, totally. I'm like, I'm down. Whatever. But it's just the coordination of details. And then if it's someplace fun, like I would hate to teach a class in Brazil and look out the window at the beach all day and not like enjoy it.
You're like, potty break, I'll be back.
Yeah, exactly. See ya. 2-hour lunch break. What?
What if you set up the tables on the beach?
That's what I was just
True.
Yeah,
you should do the
True.
whole thing out there.
That sand
That-
would be a
yeah.
bitch, though.
Oh.
That'd be awesome.
Yeah, I don't think
Props in the back.
props in the back. Yeah, totally. Okay. So now we're on to the ball of the foot. And again, continuing with the theme of finger walking. So the way that this is looking is I'm pretty much going to be finger walking the entire session, which is okay. Okay, just going vertical zone by vertical zone. In line with each toe, 3 times. And pretty much like all the fingers are moving. So it's not like that's not it. We're palpating. All of them are together.
So kind of in a way when you're doing the masseter muscle,
Yeah.
when you're going down.
They all
'Cause
come
you-
along for the ride.
The fingers, yeah.
Mm-hmm.
But just not laterally, it's more.
Mm-hmm.
Is that from the waistline guideline?
From the diaphragm guideline.
Diaphragm.
So diaphragm to shoulder, just ball of the foot. Okay. Then we could go to our digestive reflexes, starting at the proximal head of the 5th metatarsal. Then for zone 4, I'll rotate around and show you what it would look like if I wanted to thumb walk. Because at the end of the day, this is your session, it's extenuating circumstances, you have to do what makes you feel comfortable. And really, I mean, at this point during the session, we're about 30 minutes-ish in, the client is snoring, they just don't want you to stop, you know, that's, you're good from that standpoint. It's not, but, you know, clients can also smell fear. So, just knowing
It's like the bumblebee.
exactly, you know, they're if you're flip-flopping all over the place and you're like, oh, well, what if I do it this way? What if I do it that way? Oh, sorry, I hope I didn't hurt you. You know, the last thing that you should do during a reflexology session is apologize. You know, because if you're touching with intention, if you're not trying to kill them, there's no reason for you to cause pain. You know, even if they have a painful reaction or experience, it's because their body was holding tension there, not because you pressed too hard, you know. But that's if you're not trying to, you know, dig deep.
Megan Wade says she's willing to travel for beach sessions.
Yes, Megan, yes.
And then Elise again says that Sao Paulo, am I
Sao
pronouncing that?
Paulo. Mm-hmm.
It's only an hour away from the beach.
Perfect.
And then Tanya says is this an assessment type reflexology?
Yes. So at the Institute, we focus on assessment first, but at the same time, this is real reflexology. So although we're talking a lot about assessment, which is a big thing for us, and the book is based on that, we are both manually manipulating the reflexes and creating the stimulation that is a reflexology session, but then we are also assessing, because one can't go without the other, right? Okay. So if we wanted to go vertical, yeah, which doesn't look that bad, it's just like I'm kind of straddling the table a little bit. Yeah, exactly. So like if I had a nice yoga block, that would be good. But
There
yeah,
you go.
makeshift table. Actually, do you want to toss me a yoga block? Well, yeah, we'll give it a go.
Voila.
See, and this is yes.
All you need is a pina colada and the other.
I know, right? Speaking of,
Hey, we're not that far from the beach.
true.
Yeah, you
True.
can see there.
Look it up.
Actually, St. Pete Beach is 30 minutes away from
There you
here.
go.
So yeah, part of the benefit of having like miscellaneous bodywork tools at your disposal. But again, I mean, although that we're being cute about this and funny, the shoulder is still technically compromised. So if you wanted to, I would prefer you to stand. Yeah. Then you can actually get a little bit of lean onto the table as well. And if you have back problems standing, then that could be a nice way to do it. And then, as you can see, as I'm getting further and further into the reflexes, my wrist is twisting in a little bit too much, which is a no-no. So I might just switch hands and finger walk that kind of lower back bladder space.
Even from that perspective, it probably would be better to come around to the other side
Yeah,
anyway.
Exactly. But this is all you. So whatever makes you feel comfy. If you're in a place, and this is session dynamic and ethics as well, it would disturb the environment more for you to go back and forth. So you got to learn how to get creative with where you're at. Pick a spot, commit to it, and then work around it. Yeah. Okay. So double thumb walk again around the hip. Just we're done with the half-hour session, but just kind of additional reflexes. Cuboid Notch is probably the easiest. I mean, you could even thumb walk it if you really wanted to. Double thumb walk it. Whatever. The heel, medial surface of the calcaneus, which is that kind of deep tailbone sciatic space, you would need to get under. How you get under the foot here is the same way you would get under a body. You don't try to lift the body because the body will always win. You push into the table. Yeah? So you're not trying to lift and, go underneath. You are literally just sinking and scooping. It's beautiful. Yeah. It doesn't disturb the client. And really, if you've ever had that done by an experienced body worker, it really makes you feel like they know what they're doing. Okay. So finish with medial surface, use that as leverage, double thumb walk, lateral surface. Plantar surface. getting all those nice sciatic reflexes. Second row. And then depending on how tired your hands are, I mean, you could just rotate and go up. And if your hands start to really get tired, remember that, you know, when we talk about, and I'll just hold this spot because it's nice and juicy. When it comes to repetition, more is not always best. So I tell you, you know, with some places we're only walking once because they tend to get a little bit sensitive. They don't need a lot of stimulation. Other areas 3 times. If your hands start to crap out because you either haven't mastered the basics of body mechanics or you're just having a bad hand day, you went from 6 deep tissue massages to an hour of reflexology at the end, like you need a break, you know, you can slow down. You can do one pass really slow and really get in there and hold a lot of points. You don't need to, because that's just going to set your joint on fire. Yeah? So don't think that repetition is the key. I would rather you do one solid pass and take your time than do 3 meaningless because Sam said so.
She likes sideline.
Yes.
Maybe they don't know how to say
Okay. Alrighty. At dorsal aspect, same thing. Just curling on top of. Letting the tendons guide you.
So the pump you could do a little bit easier, but you would have to be at the end.
Yeah, if you wanted to. Here, I might even just one-hand it and curl in and walk back. So here I'm actually digging in with my middle finger and curling, and I'm avoiding the pump altogether. Because if I wanted to create a pump from this angle, I'd be leaning, which is going to be bad for my back. But then, you know, again, that idea, you don't want to go back and forth, back and forth, back and forth, back and forth. So creating the technique or recreating the technique from a new position in the best way that you see fit is totally okay. This is a moment to get creative as long as you're in the space and that you feel like nothing is being, you know, compromised by it. Let's see, what else? Did I miss any reflexes? No, we did toes, lower body, everything, dorsal aspect. No, I think that's pretty much it. So we would just finish with any relaxation techniques. So let's see, from this angle, we could again press in, do a little bit of back and forth with the ankle. Ankle's not really moving. That's okay, still feels good. If you wanted to, on this side, you could do not necessarily sloppy Susans. Again, see how I'm leaning, which is not good? But if you wanted to, you could twist, kind of like a slowed down, more purposeful sloppy Susan. Okay. And then push-pull, which I did all on the other side. This is also where it helps to know your foot anatomy, what bones move in what direction, what bones are actually moving, you know, things like that. Okay, can't do a heel rotation, can't do knuckle roll. I think we're pretty much it. So we'll end by unwrapping the wrapped foot and doing solar plexus adrenal one last time, and that will be that. Okay. Any other questions, comments, concerns on doing a side-lying reflexology session? Thoughts about when it would be appropriate, contraindications, anything of that nature?
I like it.
Yes.
There's a lot of controversy about doing reflexology on pregnant women. And my business coach, that's what she does. She's a pregnancy massage therapist for years. And so she has the mindset. I did a 4-hour training with her that it doesn't matter. You're not going to cause miscarriage because the body is already in the process if it does happen the day after the session or that afternoon. What is your take on that as far as reflexology?
I totally agree.
Okay.
I've had clients come in and unfortunately they've lost the baby. And we've had discussions about, based on the reflexes, why that could have been, why the body chose the life of the mother over the life of the child. Because it's a very physiological process. The body is unemotional in that way. Either it's going to kill you or it's going to kind of it's going to enhance your experience. And the body is very cut and dry about that kind of stuff. So when it views that there is an issue, normally the issue has been brewing for a very long time. And the pregnancy is already weak and things of that nature. So when a client comes in, but then on the flip side, like, I've been working on clients for months and it just didn't come up that they were pregnant.
Wow.
You know, they weren't showing. They were kind of on the heavy side. Sometimes they knew, sometimes they didn't. And in that case, like, what are you going to do? But the big concern that I have in the reflexology profession is when people say, I can determine the sex of the baby through reflexology, I can induce labor with reflexology, for reflexology for fertility. It's not about pressing a button and inducing a positive or a negative. You are helping the body to balance, which means that the body has control. You can't jam the uterus reflex or jam the prostate reflex and expect fertility to be the result if the person is eating like a garbage can, isn't sleeping, and they wonder why their counts are low. You know? Reflexology isn't going to make that better. But it also isn't going to make things happen that should not happen. So that's the rub with really any form of bodywork modality and pregnancy, is that if you approach with good intentions, if you allow the session to be about, you know, feeling good, general balance, health and wellness, and you're not trying to produce a result, that's when the gray areas start. But, I mean, the body is 10 times more intelligent than we give it credit for, so it knows what's happening. You know? Okay. Okie dokie. How you feeling, Mary?
Oh, mellow.
Oh, mellow. Good. Okay, so that is it. Hope you enjoyed the video on side-lying reflexology, and specifically reflexology for pregnancy.